sure more people will continue to join us, but we will begin now so that we don't lose the time. Me llamo Megan y yo soy la vicepresidente de San Diego Grantmakers. My name is Megan Thomas. I'm the vice president of San Diego Grantmakers, and we're so glad to see everybody here. I want to welcome all of our speakers and all of the participants who will make this such a rich discussion about our shared community, nuestra comunidad compartida, que es la región CaliBaja region. We are going to conduct this session in English. If anybody wants to speak in Spanish, you're welcome to do so, and many of us can understand and switch between, and we can help translate if that's necessary as well. Well, let's begin by joining together in a collective moment of recognition of this moment that we are in, appreciation for the peace and the time that we have, and the many people who don't necessarily share in that. And also take a moment for ourselves. We know that caring for our own well-being is important to doing the work at hand. And so I would invite us all to just settle for a moment. Maybe go ahead and mute yourself if you're not speaking. And let's just take 3 deep breaths, 3 respiros profundos juntos. I'll count them. Ready? Breathing in, breathing out, breathing in and out. And one last one together, breathing in and out. Thank you. Thank you for joining me. Hopefully spending this time here present together. And I want to acknowledge, thank you, Eliza, for sharing that we have some partners from Honduras. I know we have a number of people joining us from Baja California, Mexico. And so really not just across the country or the countries, but across the world. We are certainly all in this together. The place that I am sitting today is in San Diego County, which is the traditional and unceded territory of the Kumeyaay people. I know all of us are in a place where there are an indigenous people, and I find it especially moving and important to recognize today, because we know that the political boundary and what we're going to talk about throughout the day is about the fact that that political boundary does not separate us as a people, but rather as a construct, and we have movement of people, families, and commerce all the time. But also that the native people of this land were here, and we created these boundaries around them and over them. And so even when we think about who is an American, a US citizen, and who's a Mexican citizen, who are the residents of those places, there's the saying that we didn't cross the border crossed us, right? So our people are most certainly one and the same, and that's especially true when we think about the native people on whose territory we reside. So with that, I want to hand it over to the president and CEO of San Diego Grantmakers, Debbie McKeon, who will set a little bit of context, welcome us, and kick us off. Thanks, Debbie.
Bienvenidos and welcome everyone. And thank you, Megan. I always feel like it really settles me and grounds me and helps me think about the conversation we're having today, and especially as we think about the people upon whose land we sit and the discussions that we're having. As I think about this time in particular, I think that the systemic exclusions and the inequalities and inequities that we have been experiencing have grown geometrically during this crisis, and it's made it starkly apparent the situation in which we find ourselves. And yet, I think about the generosity of the people of our collective region of Baja California in terms of everything, time, talent, and treasures that really bring us together, and how we're really united as a binational community, where tens of thousands of people and millions of dollars of business moves routinely across the border every day. And we have truly a vibrant, diverse, binational nature that's embedded in our identity. So we're really pleased to have the tremendous lineup of speakers with us today who are really going to highlight the many ways in which our lives are intertwined. Our economy, our education, our health, and our families are connected. And I, in particular, recognize this as a strength and a place from which we draw resilience in our region. So San Diego Grantmakers is very proud to join with the Binational Migration Funders Group, Grantmakers concerned with immigrants and refugees, the International Community Foundation, Hispanics in Philanthropy, the Binational Philanthropy Partnership, and many others to welcome you to this important conversation. Thanks so much, Megan.
Thank you, Debbie, and you'll get to meet quite a few people on this journey we're about to take together. Just so you know sort of how we'll be moving forward, please feel free to use the chat that we're all familiar with now in the bottom of your screen to send comments, questions, and that sort of thing throughout the session. Try and keep yourself muted so that we can hear the speakers best. We have 5 folks who are going to join us and present, really wonderful, remarkable people and organizations representing the diverse set of activists and necessary partners for this time. And then we'll have some time at the end to engage in questions and bring everybody into the conversation. And we will end promptly at 4 and get you on your way to the next thing you're doing. So with that, I'm very pleased to introduce Ambassador Carlos Gonzalez Gutierrez, who is going to open. We're so happy to have you here from as the Consul of Mexico, and please take it away.
Thank you very much, Megan. Thank you very much for the invitation. It's great to see so many friends. Even though we cannot see each other personally, it's always nice to see you through our computers. Megan, if you could help me with my presentation so that I could go.
Yes,
faster.
absolutely. Melissa, can you cue that up? Oh, she says I'm supposed to screen share. If you want to begin, we will get that up there right now. There we go.
Well, again, my name is Carlos Gonzalez Gutierrez. I am the Consul General of Mexico. There it is. The Consul General of Mexico in San Diego. I'm a diplomat. We represent the Mexican government. And today I'd like to talk very briefly in 3 or 4 slides about the new regime that we are living and the consequences of such a shift in the way the Mexican consulate operates. If we could go to the next one, please. Well, the regime we all know, we are by now all familiar. Starting March 20th, there has been a partial closing of the border. I can tell you I never thought in my life that I would be, as Consul General of Mexico here in San Diego, appearing in printed and TV and radio and all kinds of media, inviting people not to go to Mexico. As a career diplomat, that's completely contra natura. It's something very strange. I do not wish that to anybody. It's a very difficult situation, but that was my job. That was our job as representatives of the Mexican consulate here, the Mexican government, inviting people not to go to Mexico. Because starting on March 20th, as you know, there has been a partial closing of the border to all travels that are considered non-essential. The immediate result of that partial closing was a very significant reduction in the number of people crossing. There was 55% reduction in vehicles crossing, 73% reduction in pedestrian crossing. But as in everything else, the big challenge here, at the risk of saying the obvious, is that we are dealing with a binational population. I think people in San Diego and Tijuana likes to consider themselves as part of one region, 2 countries. The problem is that the government in each of those countries have absolutely no control on whatever happens on the other side of the border. So to deal with this binational population, even in these conditions of a partial closing, it's a very significant challenge. And we have now seen how this challenge is evolving. The more the economy in California recovers and starts to reopen, the more we all face the shelter-in-place fatigue, the more we see an increase of people crossing the border. It's mostly US citizens and US legal residents, but there's an increase now of 30% vehicle, 40% pedestrian, if we consider the first week of April with the first week of May. And you can be sure that we'll see more and more people crossing the border as economic and social activities keep reopening. More workers who live in Tijuana and work here in San Diego will be asked to cross the border on a daily basis. In terms of trade impact, in the beginning, we were very proud as government officials because we saw that the partial closure of the border to non-essential travelers did not have an immediate effect in terms of commercial cargo. However, even if that directly did not have any impact, the economic crisis has certainly had an impact. The loss of supply and demand, the collapse of the market now have created a situation in which we are seeing 42% less cargo in terms of volume entering from or through Otay Mesa. In Mexico, we have always seen, now more than ever, pressure to reopen the North American supply chain and the challenges that are involved with aligning essential industries, even though we are on the different stages of the pandemic. And here in San Diego, we see grounds for misperception. What do I mean by that? In the South Bay area, most patients in South Bay hospitals are county residents. That's the area in which essential workers, low-income Latino workers live. That's the affordable housing zone of in the county of San Diego, one of the affordable housing zones. And this juxtaposition of being the closest to the border and at the same time having so much of a Latino population there has created some misrepresentation of the situation. There's some voices talking about concern about Mexicans crossing to receive medical treatment here. That empirical evidence doesn't show that. What we are seeing is that US citizens and US residents, as it is the right to do so, are crossing the border in order to get medical treatment here. Next, please. In terms of our consulate, well, we never completely closed. We have been working with no interruptions throughout this time, although we dealt only with emergencies during the first 2 months. Starting May 18, we already opened the consulate again, although we are focusing exclusively in terms of the issuing of documents with the people who had appointments with us and we had to postpone or cancel because of the pandemic. But everything else that the Mexican consulate does, particularly in the area of protection, visiting jails, hospitals, helping Mexicans in dire straits, we continue to do it, although it has been always on a remote basis through phone and internet. On a daily basis, I would like to share with you, because Andy Carey is part of this call, that our Ventanilla de Salud, that is run together with his organization, has been helping day in and day out Mexican immigrants to find a medical home. And we have tried to be as active as possible in the Spanish-speaking media and other platforms in order to orient our people, to provide information about available resources in the area of San Diego, which fortunately is very welcoming to newcomers. We are concerned, of course, because of the significant portion of Latino and Mexican nationals who have been affected by the pandemic. The county says that around 64% of all positive cases, almost 7,000 until yesterday, are Latinos. Around 42% of the 255 people who have died in San Diego are Latinos. And we have confirmed by now the death of 20 Mexican nationals. I'm sure that there are more, but at least confirmed death of 20 people born in Mexico who unfortunately have passed away here in San Diego. Next, please. I would like to finish by telling you that a challenge for us in terms of consular protection is the support that we must provide to all those people who, against their will, are being repatriated to Mexico. I just want to share with you that there's a significant drop in terms of the number of people that are being deported, 52.7% decrease in terms of the repatriation to Mexico, which means that many few immigrants are trying to cross undocumented through the border. We have developed sanitary COVID-19 protocols with sanitary authorities in Mexico to receive people who we know that are at the risk of getting the coronavirus or that have already experienced it. And these protocols are now standard operating procedure whenever we know of a case of possible concern. We have been very busy, perhaps you have seen it in the media, with detention centers around this area. Perhaps later we could talk in greater detail about the Otay Mesa Detention Center, where we saw more than 100 calls in a couple of 2 weeks of families and people detained asking for help because they were not receiving appropriate help. And we were able, working with their attorneys and with ACLU, we have been able to get the release of approximately 50 Mexican nationals who are going to go through the process outside the prison just because of sanitary reasons. There are many other things that we've been doing. I don't want to run over my time. We have been working with humanitarian paroles and special permits for people who need to cross the border and who has been impacted by the partial closure of the border. And now, more and more, we are focusing, now that San Diego is seeing a light out of the tunnel of this horrible nightmare, we are now focusing more and more on the generosity of San Diegans in order to get donations of mostly PPE for our hospitals in Tijuana. I would like to stop there. I would love to listen to the rest of the speakers. Muchas gracias.
Muchas gracias, Embajador. Thank you, Ambassador, for sharing all that information and helping us to recognize the role that you and your team play in partnership with so many people here in the United States to serve both US citizens and Mexican citizens in our shared experience. With that, I would like to invite Marcela from Fronteras Unidas Pro Salud to share with us a little bit about the story and the experiences that are happening just across the border with folks who are living there, whether they came from the United States as part of their journey or have never left Mexico. Marcela, are you with us?
Hello, sorry.
Hello. Perfect.
It's our pleasure to participate in this webcast. I want to thank San Diego Grantmakers for the invitation. My name is Marcela Merino. I'm the Executive Director of Fronteras Unidas Pro Salud, better known as Pro Salud. Dr. Esther Oviedo, Director of our community program, will share later on her experience. Pro Salud is a non-profit organization aimed to promoting social development and well-being of people through a free and well-informed exercise of their rights, in particular sexual and reproductive rights, thus contributing to the decrease of the inequities among the most vulnerable population groups. ProSalud is dedicated to the idea that healthcare is a right that transcends political borders and economic lines. Everyone, no matter where they live or how poor they are, should be able to access affordable, high-quality healthcare services. At ProSalud, we do not wait for people to come to us. We seek them out, and we will continue to seek them out until they receive the healthcare they deserve. This pandemic has represented a big challenge for ProSalud. Since last week, during March and April, we have adopted video telephone visit technology to provide care while keeping everyone at a safe distance. This has allowed us to stay in touch with our patients and serve their needs. Since last week, we have opened our 2 clinics to more in-person, face-to-face visits with our patients. All our clinics are already low-risk places for COVID. We are continuing to refer COVID symptoms to other clinics' urgent care. Our staff is required to use masks, and we have developed distancing and cleaning protocols. Now, I would like to ask Dr. Oviedo to share her experiences in the community. Please, Esther.
Good afternoon. It's a pleasure to be here with you. I'm going to talk to you about the work we are doing in the community on the COVID-19 pandemic. Next one, please. Next one. We have 2 projects. This first project is to serve migrants in the shelters. The name of the project is ProSalud Mobile Clinic, an effective and practical strategy to provide medical and educational services in homes and shelters for migrants, particularly around health and safety issues due to the outbreak of the coronavirus. This project is financed by International Community Foundation, and this is about Humanity Fund. In a period of 3 weeks, we have served 288 people in 7 shelters. You can see in the photo a takings of a child temperature at the shelter Casa Hogar El Puente. Next one, please. I'm going to tell you a little bit more of what we do in the visits to the shelter. We went to the shelters with all the personal protective equipment, as you can see in the photos. The team is made up of 3 people to reduce the risk, both for us and for them, a doctor, a nurse, and a medical assistant. Cleaning supplies are delivered at each visit, emphasizing the recommendation to avoid the transmission of the disease. In this photo, you can see the director of Casa del Deportado Sagrado Corazón, Perla del Mar. Next one. One of the deficits most previously found on the shelter was the lack of hygiene measures, which is closely related to the presence of infection of different types in the habitants. We have observed a remarkable improvement in many of the shelters, but in people's hygiene and in the shelter, and it's evident in the improvement of people's health. Even they are surprised that they have not gotten sick. We hope that these measures remain after the pandemic phases, because people are becoming aware of the importance of hygiene measures for the prevention not only of COVID-19, but also of many other diseases. Next one, please. For this reason, it is very important for our work, in addition to providing them with the instruments so that they can follow hygiene measures and give medical attention to those who require it, providing them with educational information to be able to attack the disease by preventing its transmission. We have had a lot of response from the directors of the shelters, who have always been interested in learning, in following the recommendations. They are very strict with people. In most of the shelters, they do not go out at all, only if someone needs something urgent, or in those who go out to work, they are asked to take all the protection measures, and when they arrive to the shelter, they have to change clothes, bathe before they can get in touch with their family. In this photo, you can see the director of Misión Evangélica Roca de Salvación, Salvador Cepeda. Next, please. We take the temperature of all the people in the shelter and ask about symptoms of COVID-19 to detect suspicious cases. Medical consultation is provided only to the cases that really require health care, and we follow up until its resolution. Next. Fortunately, we have not found serious health cases. Only in one of the shelters, 2 people had suspicious symptoms of COVID-19, but they did not present the serious disease. They were isolated, and when we went to the shelter, they no longer had symptoms. On the photo, you can see a 3-month-old baby. He was in good health, but did not have the vaccination schedule. This need was followed up, and the baby already had their shots. Next. Another of the most important cases we saw was a 7-year-old boy from Honduras with chickenpox and bacterial superinfection of the lesion and of his eye. This is very common by scratching the lesions. The boy was treated and now is currently well. Next. In March, ProSalud received a donation of ecological soaps from the United Nations High Commissioner for Refugees, and we began to distribute them in the shelters to implement hand washing. 600 soaps were delivered to 5 shelters. Next. Another project we have is to serve the seniors because they are other vulnerable group neglected. We want through health promoters make aware and educate elderly with COVID-19 prevention measures. This is funding provided by International Community Foundation and Grupo Coppel. The goal of the project is to serve 350 people, for which 10 health promoters were trained in COVID-19 issues. Next. Each promoter was provided with the necessary protective equipment to carry out their work. Next. We want through them, women from the community, make aware and educate adults with COVID-19 prevention measures, deliver hygiene items, follow up on health conditions that are required, and reduce risk for them to acquire the disease. She is a health promoter. Her name is Leticia Hernandez. Next. She is another health promoter. Her name is Wendy, and she's receiving information about the 10 steps for preventing COVID-19 in elderly. Health promoters are people who have the full confidence of their communities, always interested in participating in community work, looking for ways to learn and share their knowledge to people. Next. Another health promoter, Priscilla. She's on a visit to a senior person home. And one of the things that we always remind them is that the first thing they must take care of is their health and well-being, following safety measures for the protection of both the promoters and the seniors. Next. And she is Marisela Gonzalez, another health promoter, one of the best, on a visit to a senior person home. And thank you for your attention.
Thank you, Esther. I want to thank all the people who participate and hope that we had shown our work, or the work that ProSalud is doing during the pandemic. Thank you.
Thank you so much, Marcela. Thank you, Dr. Oviedo. And thank you for all the work that you are doing. And we certainly recognize the value of the promotoras, all of the volunteers, the people and staff who are visiting our community members who need information and supplies so that they can be safe and also participate in our community-wide efforts. I'm very happy to introduce Paulina Olvera Cañez, who is with Espacio Migrante, which is one of the locations that has been providing shelter and advice and support for a very long time, and is having to adapt to this new situation, not only with health and economic, but also the political changes of policy that are causing people to be differently and more stranded and needing additional help. So Paulina, thank you so much for being here with us today, and please share what we should know.
Thank you very much, Megan, and thank you, San Diego Grantmakers, for organizing this webinar, and Eliza and ICF for the invitation. I don't know if you can help me to set up the presentation. I would like to start by saying that Espacio Migrante, we opened up our shelter last year in February of 2019. And I want to talk a little bit about the context that we were living before the pandemic. So in our shelter, it's a shelter for asylum-seeking families, and half of the population are people that are on the metering list, which means that they are on the waiting list to seek asylum in the US, and about half of the population is in the MPP program, which is Migrant Protection Protocols, which is a policy that was implemented since last year, and in a few words, it makes asylum seekers have to wait for their process while they are in Tijuana. So this has caused a lack of access to their due process, a lack of access to US attorneys, because people are in Tijuana, so it becomes really difficult to get in touch with attorneys and organizations on the US side. And this has also caused many mental health issues on families that are fleeing from their lives and are forced to wait in Tijuana for a long period of time. We also have a work with the community. We have a community center where we offer services like Spanish classes. Particularly, we work with the African and Haitian communities in Tijuana. And some of the issues that we're facing since before the pandemic are the raids that are performed by Mexico's National Guard, which is a task force similar to the military, which has faculty to support INAMI, Mexican immigration, on immigration raids. And they have used racial profiling to target Black immigrants in particular. So this was the context before the pandemic, but we think that the pandemic has just increased or magnified all these issues that were already affecting the immigrant communities. Next, please. So as Ambassador mentioned, on March 20th, there was a partial closing of the Mexico-US border. However, this partial closing didn't include asylum seekers as part of the essential travel activities. And at the same time, the US began to immediately deport all immigrants crossing the border. So this means that asylum seekers are now facing a bigger limbo, and they are having to wait indefinitely on the Mexican side. This means that new people arriving from Tapachula to Tijuana can't put their name on the waiting list, and they have no way to seek asylum in the US. This has only helped to deteriorate further the asylum process in the US, which is something that the Trump administration had already begun to do with these policies, such as the metering list and MPP, but now with the partial closing of the border, it's become impossible for asylum seekers to seek international protection in the US. Next one, please. So another issue is that MPP hearings, so people that were already in their process attending to their hearings in the US, there was a suspension that was extended now until June 22nd. But we believe that it's very possible that this will be extended depending on the evolution of COVID-19. There are currently 65,000 asylum seekers along the Mexico-US border that are in MPP. And in Tijuana, there's approximately 7,000 that are in this situation. Next one, please. So the shelters in Tijuana. So we have a shelter for families, like I mentioned. So in March, when we began to see everything that was happening and the measures that were being taken on the San Diego side, and we saw that there weren't really any measures being taken on the Mexican side yet, but we decided to reach out to an epidemiologist in Tijuana. Her name is Yetza Bojorquez from COLEF, and we asked her for advice on what measures we could take as shelters in order to protect the families in the shelter. So we decided to take measures like the ones that have been mentioned. We are working behind closed doors, which means that we close down the community centers, we stop receiving volunteers, most of the staff is working from home, and the families can't leave the shelter. However, they are provided with housing and food while they are at the shelter. This has affected many shelters, the closing of the border, because many shelters in Tijuana depend on donations and volunteers that come from California. So they have also struggled to meet the basic needs because they have stopped receiving this help. because of the closing of the border. Another issue that has affected shelters is the desabasto, the lack of products in the supermarkets in Mexico, and also in the supermarkets they are my English is failing me. They are rationing the amount of products that you can buy, and for us that has been a big obstacle because we can't buy enough for all the people at the shelter. They are only giving us products for a single household. So that has been another issue that has affected us. But we believe that the biggest issue is the lack of capacity of shelters to isolate population that could get sick. So that's one of our biggest concerns, because we don't have the capacity to isolate somebody, and especially because we have population in the shelter that is high risk, such as elders and people with health problems such as diabetes. The closing of the shelters also means that new people coming in to Tijuana from Tapachula can't find any housing options in the city. Right now, from 24 shelters in Tijuana, there's only one that is still receiving new population, and this has caused also a housing crisis among the migrant communities. Next one. We are also working with immigrants that are no longer living in shelters. So there are many migrants that were already out of shelters that had found a job, and now with the closing of restaurants, factories, and maquiladoras, they now don't have any options to pay for things that are essential, such as food and rent. And this has especially impacted Black migrants in Tijuana. We have been speaking with community members from Haiti, Cameroon, and Ghana, and other African countries, that in addition to this situation, they have faced racial discrimination and police abuse in Tijuana. So next slide, please. So we started implementing a program that is called Tijuana Migrant Community Relief Program, in which we started speaking to some of these families that are part of the immigrant community that don't live in shelters. We started with a list of 160 families, and we applied a questionnaire to ask them about the impacts of COVID-19 in their everyday lives. And it was really a challenge because many of these populations speak French, Haitian Creole, and English. So we had to find volunteers and community organizers that speak those languages. But the conversations have been really interesting, and we have found that some of the main issues that are affecting immigrants are access to health, because even before the pandemic, some of these populations didn't have healthcare in Mexico. And some of the things that we have heard from these testimonies, I remember a Ghanaian migrant that was sharing with me, my wife is pregnant, but we don't have healthcare, and we're scared to take her to the General Hospital of Tijuana. We don't know if they will give her attention. So there's a lot of lack of information, and also a lack of access to healthcare. The other two issues that have come up the most are food and housing. And the fourth one is documentation. So we have found that hundreds of these migrants don't have documentation, even though they have been in Tijuana since 2016 or 2017. So next one, please. So thanks to organizations like Al Otro Lado, ICF, the Latina Giving Circle, and IOM, we have been able to bring help to some of these families. We have already delivered food aid to 60 of these families. What we did is that we got food gift cards, that they can use at the supermarket to directly buy the things that they need the most, either food or hygiene stuff or cleaning supplies, or they can use it to buy medicine at the pharmacy. It was really another big experience for us because we gave appointments to 60 families in a week, and in the second day, we had more than 100 families outside of Espacio Migrante asking for help because the word spread out very quickly. And in general, there's a lot of need in Tijuana for these families. So now we're working with a list of 500 families, and we're trying to find resources so we can deliver the basic needs, which is food and help for housing. The last point I would like to mention is that Tijuana is still living in a context of violence. Many of the migrants that we have spoken with have experienced some sort of abuse by municipal police in Tijuana or the National Guard. And we are very concerned for an announcement that the Mexican government made that would give the military faculty to perform security operations and immigration operations in Mexico. So we think that it's a bad response from the Mexican government that could put in danger these families that are already in a vulnerable situation. So that would be all on my part. Thank you very much for the time.
Thank you so much, Paulina. Gracias. And thank you for reminding us at the end that not only do we share so much in terms of people needing very basic supports like food and shelter, and that there's more need right now than we have resources to provide, but the systems that existed before that made people's lives so difficult, the police state, the exclusions and oppressions, are still there. And so this pandemic is just making those things more stark, worse and more difficult. And that is our responsibility to look ahead and plan for a better world. We're still going. We have 2 more speakers, and I'm so happy to invite Paula Avila from the San Diego Regional Chamber of Commerce now to start to talk a little bit more about, again, this linkage and the codependence that we share, that our futures are intertwined, and describe that to us here today. So thank you, Paula, and please take it away.
Great. Well, thank you very much for having me. It's a pleasure to join you. This has been so informative so far as well. I really enjoy being in the presence of these fellow panelists. I'll share mostly from the perspective of the economic challenges and the economic side of the pandemic and its implication on our region. As you mentioned, you know, our border region here is one that is, it thrives because we are one. We are completely tied with each other. And our economic interdependency is present now more than ever. But that also gives us the advantage of overcoming this challenge easier perhaps than other regions because of our deep collaborative ties, our history of working together. Officials, government officials, representatives of nonprofits, the business community, community leaders, they know each other on both sides of the border already. So when we are faced with a challenge such as the COVID-19, we're not just trying to now meet each other and find out who we need to connect with, we're already connected. And so I'll just emphasize that this collaboration is both the most important ingredient right now to overcoming this challenge, and also as we move towards economic recovery, this will be what will get us through the economic challenges as well. So as been mentioned, and the ambassador mentioned this in particular, we were initially faced with the challenge of, with the border restrictions, but also, as he mentioned, aligning the definition of essential businesses as stay at home, and business closure orders came into practice. And they happened at different times on each side of the border, which does impact our supply chain. We have a very healthy integrated supply chain where we are co-producing with each other. And when you have that integrated supply chain, it's critical to implement or make sure you synchronize policies and coordinate those policies so that you do not cause a disruption to the supply chain. And one of the main reasons why that supply chain is important more than other things is we are the largest medical device manufacturing cluster in the world when you put two sides of the border together. And we're producing here everything from ventilators to PPE, other medical devices that are required for IVs, and monitoring patients. So it's critical, more, aside from many other essential businesses, that we keep the supply chain without uninterrupted. As part of our trade, cross-border trade here, we also have a very healthy food supply chain that crosses the border. And that's everything. You have to think about what goes into supporting these manufacturing and food supply chains. It's everything from the agricultural worker to the truck driver that needs to cross the border to drive the supplies and take them to the destination. So another very important part of this is the workforce. And so as these policies were being worked on in government and throughout the time, in the meantime, the business community and community leaders, nonprofits got together to it created a work group to help identify the essential businesses that needed to remain open, advocate to the government to allow them to open, also advocating, working with CBP to ensure that with the border restrictions, the essential workforce that supports this healthy and vibrant traded cross-border commerce is able to access the ports of entry. So it was, in the lack of certainty and coordination, as this fell upon us as a region, it was really everybody coming together, working together in the meantime, to help to prevent disruption in these very important supply chains. The other thing that I'll mention is surveys that were done. As was mentioned by a couple of the other speakers, it was critical to identify what businesses and the community as a whole needed to support, to help them in the meantime while they were closed. During the closure, helping businesses stay afloat, even if they were closed, ensuring that their workforce could continue to receive a paycheck, which also is tied to their health insurance in many cases. And so we surveyed the community on both sides of the border. We worked with our partner organizations in Baja and surveyed thousands of businesses across sectors to see what was the impact that they had and what were their needs. And then that was delivered to many of the decision makers that was needed. We received a lot of good input too, moving forward into recovery, economic recovery plans. Every task force that was formed, both at the city of San Diego and with the county of San Diego, across, they had binational participation, so that those decisions and input is coming from both sides of the border, which is critical. And some of the forums that we held across cross-border sectors to receive input on how we can support the community, it was very fruitful, really informative. Some suggestions like creating a binational task force to promote investment in the CaliBaja region. Once we move towards recovery, what can we do to promote our region and the great assets that we have, that we share here? Working with CBP, the Customs and Border Protection, to ensure that as businesses begin to reopen and the workforce begins to go back to work, that the operations at the ports of entry reflect the demand. As the restrictions were put into place, hours of operation were reduced, as well as lanes that were operated. And in some cases, we've seen very long or extended border wait times. So it was important to work with government to ensure that we can continue to facilitate that trade that's crossing the border, which is really important, like I mentioned. And then I'll mention that a lot of this is ongoing as well. There's additional work that will be needed as we move in different phases. Again, some of the long-term impacts, of course, aside from some of the humanitarian and health issues, is the economic impacts, and that impacts some of our poorest communities. What support will the workforce need moving forward as well? And re-envisioning what that workforce is going to look like, as some jobs perhaps will never recover, will never come back. What are the needs of the future workforce, and how can we train for that? Because there's this urgent need to do that now. It is not something that we can just plan for in the future. These are transformations that are happening now that were accelerated because of COVID. And on the brighter side, there's the collaboration that I mentioned. Businesses and nonprofits came together, identified some of the needs of the region. There's been databases that have been formed, identifying the needs, and then collecting information on supplies, connecting the needs with resources. The city of San Diego, Mayor Faulkner announced he was ordering the donation of 1,000 shields to be donated to hospitals in Tijuana. Examples like that, which really show leadership and deep collaborative ties at every level. We know UCSD also donated some medical supplies and staff as well, which is in great need. And again, something that is going to be ongoing and will really be the reason that we will recover perhaps better than other regions. That is our perspective. Thank you.
Thank you so much, Paula. I think it is clear that we have a shared strength and resilience, and facing up to this is something we need to do together. So to bring us home, I'm really pleased to invite Eliza Brennan, who is with the International Community Foundation and one of the leaders of our binational migration funders group at San Diego Grantmakers, to talk about the role of philanthropy. And she has some slides which I am going to share now. So thank you, Eliza. Please take it away.
Thank you. Can you hear me okay?
Yes.
All right, great. Well, first, thank you to Debbie and Megan and the San Diego Grantmakers team for coordinating this, I think, very important conversation. And I'm recognizing that we're running a bit tight on time, so I'll do my best to sort of wrap up. I think that everyone, all of my fellow panelists, have really given an excellent overview of the interconnectedness of our region and the collective challenges that we're facing. And I think no matter what communities or regions of the world everyone is from on this call, there's probably a lot of resemblance in the types of challenges that Paulina and Paula and Marcela have all described. So I think there's a lot to reflect on. As Megan said, I will just quickly highlight some of the challenges that we're seeing in the nonprofit sector kind of more broadly, and how philanthropy and charitable individuals are really stepping up in our CaliBaja region to support efforts in Mexico. Megan, if you can go to the next slide, please. This is just quickly give everyone who's not familiar with ICF an overview. The International Community Foundation is an international nonprofit. We're based here in National City in San Diego County. And since 1990, ICF has been inspiring and facilitating charitable giving from U.S. donors to international causes and nonprofits, with an emphasis on the Baja Peninsula and, of course, our own CaliBaja border region. But we also have expanded our reach throughout Mexico and several countries in Central America and other parts of Latin America. And interestingly, over our 30 years, we've invested nearly $100 million, and of that, about a third has gone directly to the border region. So it's obviously a region that we care very deeply about. And given our deep relationships here, when the COVID-19 outbreak began, our donors and other partners from across the country and really the world immediately began asking how they could help across the border. So as a result, since we can move to the next slide, please. As a result, since mid-March, ICF and our donors have invested over $320,000 to 30 organizations in Baja California directly and intentionally for COVID-19 response. This includes over $65,000 for rapid response funds that were deployed to many of the migrant organizations and their supporting organizations. So ProSalud's Mobile Health Clinic, Espacio Migrante, so for basic medical and PPE supplies, and of course food, which continues to be a challenge, I think, throughout the Baja California community. Following that, we also launched, we launched a very successful fundraising campaign with our partners. This is about humanity, and we're able to do a call for proposals within a 3-week time period for our Border Health Fund, and granted about $120,000 to 17 organizations addressing immediate needs. And of course, we received proposals for far more than we were able to fund. So we received about 80 proposals from different nonprofits throughout the state of Baja California. And of course, I'm very happy to share those proposals or the list of organizations with anyone who might be interested. But it gives a really kind of broad sense of the immediate and midterm needs that the nonprofit and generally the community are facing. Of course, many of those have already been addressed, so I'm not gonna repeat. But access to healthcare, food, and of course medical treatment, PPE are immediate needs. Looking a bit more midterm, we're also seeing that nonprofits are needing flexible general operating support just to overcome this challenging period. A lot of the local organizations are facing significant losses in revenue due to lack of ability to engage with their donors. Many of them have depended on in-kind donations or site visits or fundraising events, all of which are obviously not happening. And then donors, I think, are beginning to sort of redirect efforts and buckle down within their own communities. And so I think in a region like Baja California, there are obviously needs in San Diego and in other regions where our donors live. And so we're, I think, facing a lot of uncertainty in how that's going to affect the long-term financial situations for these organizations in other parts of Mexico and the Baja Peninsula. While urgent needs are, of course, going to continue to be ongoing, we're also seeing organizations are already shifting their focus to mid and long-term needs. There's talk of schools not reopening in the fall, and then, of course, adjusting services to abide by social distancing guidelines, and helping with the long-term economic recovery and addressing issues of how to support people, such as the program Paulina mentioned, support people who have lost incomes and are probably unable to enter the workforce for some time. So all of these changes are requiring a significant investment of nonprofit staff time and resources that they had not budgeted for in their annual budgets. So I think, you know, and not just in Tijuana or in our border region, but across the board, foundations are being asked to give more general, flexible support to help local organizations survive this period. Similarly, we're also seeing, sorry, can we go to the next slide? I think to echo Paola, our border region is characterized by the spirit of collaboration and really close-knit relationships across the border. There have always been a number of different collaborative groups, such as the Smart Border Coalition or Border Philanthropy Partnership, who are bringing together partners from both sides of the border, the Chamber of Commerce, and even the two cities at a government level. So I think it is not too much of a surprise that we've seen a lot of concurrent efforts to support medical, food, and nonprofit needs on both sides of the border. And so ICF's response has very much been defined by partnerships. I will not go into detail on all of the ones listed here, but just wanted to mention that of course, in-kind donations have required the assistance of the Mexican consulate and customs agents. Border Philanthropy Partnership, who is working with both of those partners and facilitating in-kind donations. ICF doesn't actually receive in-kind donations, but if anyone is looking for a resource or for local nonprofits to connect to give donations to, we are happy to serve as a resource and have been doing that as well. We've also been working with Tijuana Innovadora to launch a regional coordinating body, which has already been very helpful for sharing resources. Apoyemos at Tijuana has been a main source of coordination for the public hospitals and all of the different in-kind donations that are coming in for PPE and medical supplies. And then local partners such as the U.S.-Mexico Institute, who are also bringing together different stakeholders to talk about the long-term needs. So just to jump to the final slide here, ICF's already thinking ahead to what is next once we're out of this emergency phase. And I think, again, organizational stability is really important for the social safety net of the region. This financial crisis hit them hard, and we know that these organizations are filling gaps that there's truly no one else filling these gaps. And so we feel very strongly that it is important to invest in the stability and long-term success of the local nonprofit community. And then, of course, identifying opportunities to invest in long-term changes that might be required. So workforce development, education, food system, we're very much actively seeking opportunities to work with people who are also working in those spaces. So again, thank you to my fellow panelists, and thanks to the SDG team for this opportunity.
Thank you so much, Eliza, and thank you, everyone. We have run right up to the end of our time, and I want to encourage anybody who has a question to add it to the chat now, or feel free to email it. You will receive a link to a recording of this session via email in the next couple of days, and you're welcome to respond to that with questions that you have, and we'll make sure to share the answers out. I can't thank enough everybody who is participating today in any way, and of course all of our speakers for making the time amidst their busy schedule. I really want to recognize and acknowledge the group that inspires and informs me, which is the Binational Migration Funders Group at San Diego Grantmakers, that Andy at the Border Philanthropy Partnership, got the name right that time, Eliza at ICF, and so many of our partners are a part of, and the many different ways that they are working in their own specific efforts. BPP delivering medical supplies, ICF starting this fund, GSER working with undocumented individuals, and Hispanics in philanthropy doing their thing, and then collectively coming together to share information and try to be as coordinated as possible, and doing that in a way that embraces the role and the importance of the consulate and the Chamber of Commerce and our government, U.S. government, and just everybody, because we truly are in this together. If we take one message from today, is that we're all struggling, but we also all can have hope because of the efforts that are evident here today. So, gracias a todos y a todas. Thank you so much for being with us. Please don't hesitate to reach out. Please take care of yourselves, and we will see you next time. Thank you.